All right, we are live. Hello, everyone, and welcome back to another episode of the Hustle Science Experiment. Today, I'm really excited to welcome onto the show Dr. Irshad Shakir. Dr. Shakir, welcome. Thank you so much for spending some time with us today.
Yeah, hello, and thank you for having me on today. I really appreciate the opportunity to kind of talk about myself and talk about orthopedic surgery.
Incredible. I'm looking forward to getting into it as well. But first, I just want to talk about you for a second. You've got a decorated career. Today, you're an orthopedic surgeon. Um, Operating in private practice, which is great, and we look forward to learning about the lessons there. But you've spent a big part of your career in the United States Air Force. So first off, thank you for your service. For being a veteran doctor in our community. And one part of that career that I thought is really interesting that pops out on your LinkedIn is serving as chief of staff at the Prince Sultan Air Base in Saudi Arabia as one of your deployments. Wow.
Yes, that was a great experience. And while I was in the military, I served as an orthopedic surgeon. I was stationed primarily in Nellis Air Force Base in Las Vegas, Nevada. And I had one deployment for 7 months in Saudi Arabia. At that time, it's an austere environment, which just means it's a relatively safe environment with other branches of the United States military there as well. And as chief of staff, I was the head doctor in charge of the hospital setting that we had there. The hospital setting in Saudi Arabia for us is a tent. So we had tents with supplies and whatnot. And so it was a challenging experience, absolutely. But the key aspect of that deployment that I remembered the most was during that time, we were rescuing the Afghan refugees who were leaving, and a lot of them had to stop over through Saudi Arabia. And so here we are, about 15 doctors there, and 1,500 patients show up at 2 a.m. That were,
Wow.
refugees that we were evacuating, and that was a challenging experience. And when you go through something like that with a group of people, it's certainly memorable and one that I cherish to this day.
Absolutely, and thank you for the work that you've done to help refugees in the world. I mean, that's incredible work. What inspired you and led you to this path of becoming an orthopedic surgeon and also your time in the Air Force?
So becoming an orthopedic surgeon has been a pretty long and arduous path, to be honest. It's very difficult to go through a medical school and
Right.
residency. To me, orthopedic surgery just was a calling. As a medical student, they make you rotate through all the different specialties to kind of give you a taste of all of them to figure out what you're interested in. And the orthopedic surgery patients and the orthopedic surgeons that I worked with, I just felt like I was one of them. In terms of the surgeons, their bedside manner, their care for each person, and they wanted each patient to get better and get moving again. And for me, that's what I want to do. I want to help people get better, get moving, keep active, go for hikes, go traveling, chase their grandkids around. When you're limited in your mobility, is when life just isn't as fun when you're limited by that. And so for orthopedics, it kind of was a no-brainer to me. I wanted to help people keep moving.
That's great. Yeah, I love that. I remember when I had broken my arm, I had an orthopedic doctor that had incredible bedside manners in the sense that just motivated me and inspired me, and it was really a memorable moment. I think I was 12, and I still remember that. Um,
Yeah.
so for our profession,
I still
oh,
think that
sorry.
I have the best job in the world because I get to help people get better. And there's certain aspects of medicine that it's difficult, right? There's cancers, there's diabetes,
Right.
there's things that doctors can't help everything. They can't fix everything. And I'm not saying orthopedic surgeons can, but ours is very gratifying. There's something wrong, we can surgically help or non-surgically help, and they get better.
That's great. That's awesome. And so, for our professional lesson today, we're going to be talking about how healthcare providers communicate with their patients. And it's a really interesting topic that you brought up because I think healthcare is changing a lot right now. And the more that I talk to doctors like yourself that are also very entrepreneurial, they're bringing some new thoughts into the industry. And so, could you open this up? Why is this important?
Yeah, so I think that I believe that the newer generation of healthcare providers have become wise to the fact that it's a mutual relationship and understanding between patient and provider, especially in the field of orthopedic surgery. Obviously, trauma surgery, if it's very clear surgery is needed, your appendix has burst, your bone is broken, you need surgery. That is a no-brainer. But in reconstructive orthopedic surgery, like what I do, it's wise that the provider and patient get on the same page. What I mean by that is there's a lot of non-operative options. I think that back in the old days, I put air quotes, back in the old days, doctors would come, take a look at the x-ray and say, yep, you have knee arthritis. Yes, you have hip arthritis. You need a hip replacement. You need a knee replacement. And for me, I frequently tell patients, I don't treat x-rays, I treat people. Your
Right.
X-ray can show severe arthritis, but hey, are you able to do most of your things in life? And I've got patients say, you know what, I still golf, I still do this. So their X-ray has bad severe arthritis, but they're still doing most things. So who am I to say they need surgery if they're still able to do most things? So I think it's one of those things where we have to work together, patient and provider, and just kind of come up with a goal, come up with, work together in terms of what their expectations are. Now, I will be honest that the x-rays eventually may stop them from continuing their golf and may stop them from hiking and chasing their grandkids around the house. And at that time, then we can talk about surgery. But I usually don't lead with, hey, we got to do surgery just because the x-ray shows that. And I have found in my practice so far that it's refreshing for patients. When a surgeon walks in and isn't trying to tell you you need surgery right away, they tend to trust that doctor more because it's true. I want them to be ready for surgery, and I want it to be a decision that they make themselves, not because I said so. So I want them to realize, okay, my knee hurts, and I stopped doing things that I enjoy. Okay, he's right. Now it's time.
Yeah.
A common question I get from patients is, "Hey doc, when's the right time? When should I do it? When should I have my knee replaced? When should I have my hip replaced?" And I always say the answer is, it's not my knee, it's not my hip, it's yours. You'll know. You'll stop doing those things that you enjoy, and that's when you can't live your life like that anymore. So you got to come in and get it fixed. I always tend to get personal with my patients and say, hey, I give the personal example of my mom. My mom had a knee arthritis, and I noticed she was getting injections and they were working. The steroid injections were working, and she did them for a couple of years. And then I would notice she stopped going to get the mail. She didn't want to go to the grocery store anymore. She didn't want to play with the kids outside. And I was like, hey, what's going on? My knee hurts. I was like, okay, now it's time. Now,
Yeah.
her x-ray didn't change much in those 2 to 3 years, but her function changed. And if that doctor who saw her 2 years prior was like, oh, you need the knee replacement now, she was doing most things at that time. Why would she need it? Now, 2 years later, after the disease progress had gotten worse, she needed it. So I think the key that I'd want to get to people is that find a doctor that wants to treat you, not your x-ray. And I think that those kind of doctors are the ones that you'll find just have your best interest in mind. The other question that people ask me is, hey, should I get a second opinion? And I always say yes. If you think back in the day, our parents, they would never think of doing such a thing. They would trust
Right.
their doctor, and that's what the doctor says. That's what I'm going to do. If people ask me, like, do you think it's worth it? I'm like, yes, absolutely. I want my patients to be fully informed and understand everything. And if they need to hear it from different people, or if they need to hear different opinions, by all means. Again, I like to summarize by saying it's your knee, it's your hip, not mine. I'm just because that's my opinion is one thing versus your opinion is another.
Right. Yeah. Surgery can be a terrifying situation to walk into for a lot of folks, and so I'm sure people can really appreciate the distancing that you can help create, and help create some other options. Why do you think there was this paradigm in healthcare that doctors didn't have good bedside manners? Maybe a generation ago, and what has helped you in terms of shifting that paradigm in your own practice?
That's a great question, and I don't know why it used to be that way. I think that's just things perpetuate themselves. That's how those doctors were trained. So
Mhm.
they try to train everybody else that way. It's a downhill effect. I noticed when I was a resident, there's a lot of things in medicine you learn what to do. I made special notes of what not to do. And so
Gotcha.
I found myself seeing patients unhappy with the way certain doctors would talk to them. And I'm like, I'm not going to do that. I don't
Right.
want them to be so unhappy with the way that they talk to each other. So I made notes of that. And I would say I'm not the only one that did that. I think that, as our generation has kind of, let's be honest, has made social changes to the world, that we realize that, like, let's be kind to one another. Let's work together. It's not about, I'm the doctor, you do as I say. That day should be gone. And so I noticed what to do, what not to do, um, during my residency, in terms of patient care. And then I realized, those type of patients are the ones that respect you more. They tend to want you as their doctor,
Yeah.
because you involve them, you get them communicating with you.
Yeah. Yeah, that's great and important in terms of client retention, at least from a business perspective as well. And so there's some alignment there, on the people end as well as the profits end, which is a part of the reality of operating in healthcare. What one more question on the professional side, and we can move on to the rest of this interview.
Sure.
What advice do you have for young folks that might be interested in a career in healthcare?
Um, my advice is this, and it's an advice that, a relative of mine gave me when I was considering it. Healthcare is hard. Being in healthcare is hard. It's a long, arduous path. It's a hard road, but it's very gratifying when you get to the end. So if you are a person that needs like instant gratification, it's tough. Now I'm speaking of like orthopedic surgeon. I had to go through 4 years of college, 4 years of medical school, 5 to 6 years of orthopedic surgery training, and then I did a 1 year additional fellowship. So we're talking like 16 years of just all of this stuff to get to where I am. And I finally feel like I got it, and I've arrived. So it's not easy to go through that path, but it is extremely gratifying. So the advice that was given to me was, you got to really want it, and you got to want it with your whole heart. And when you do, you'll succeed.
That's great. Thank you. Thank you for sharing. So, moment of gratitude. We do this piece because I believe it's important to celebrate gratitude and, check ourselves and, start every day with appreciation and remind everyone that's listening to always do that. Um, what are you feeling grateful for today?
I'm feeling extremely grateful for my family. So being in medicine and going into medical school, residency, fellowship, I'm not sure if you're aware, but a lot of those decisions on locations are not made by you. And so
Right.
I have moved from Chicago to St. Louis to Las Vegas to Nashville, and Nashville to now finally in Scottsdale, Arizona. And so my wife has followed me through this whole path. We have two beautiful children at 7 and 5. And, you know, people in healthcare understand how hard it is on their families as well. So my moment
Right.
of gratitude is that my family has supported me wholeheartedly throughout this difficult process. And now that we've arrived and are starting my forever job, it's just nice to thank them for sticking through it.
That's wonderful. I love that. Thank you so much for sharing. Um, so for our life lesson today, you had mentioned you want to talk about focusing on preventative care for the client, instead of the last call emergency solution. Can you tell us more about that?
Yeah, so I can speak specifically to orthopedic surgery, but I think I can start by talking about healthcare in general. I think, and I'm hoping that I'm not generalizing here too much, but I think the United States healthcare does not do a good enough job at preventative care and worries more about fixing the problem when it's become a bigger problem. And that's
Right.
because we don't have enough primary care doctors. We don't have enough family practitioners, and that's a problem. And so preventative medicine can save long-term healthcare dollars and healthcare patient-wise. Meaning, if you have mild knee arthritis at a younger age, if you are to exercise regularly, maybe lose a little bit of weight, try knee injections, do other things, you may not need a knee replacement surgery. So I can talk about orthopedic surgery and in terms of the preventative care, but you could really, if you want, talk about healthcare in general. If you're slightly overweight, you have long-term health complications that can occur from that. So you really want to maybe see a dietitian, as opposed to just letting it get out of control. And now you have a heart problem 5 years later.
Right.
So if we talk about how can we stop problems before they become bigger problems.
It's definitely part of that partnership that you had mentioned before, partnering with your patients. Um, arthritis and some of the challenges that patients face when they come to see you, are these a mix of lifestyle and genetic complications? Is it 100% lifestyle? What does that look like? And what should folks, even people like myself or, other folks that might be listening that might not think that they could have this issue, but, 20, 30 years passes around.
Sure.
What should people be doing to prevent this in the first place?
That's a great question. And to be honest, there's not a direct link between lifestyle, familial, or whatnot. Right now, we're seeing that it's multifactorial. There has been a recent article that demonstrated if somebody in your family has arthritis, you're more likely
Okay.
to get arthritis. So what is arthritis? Arthritis essentially is worn out cartilage. I actually have a model here. So here's a knee. All right. So when I bend the knee, I don't know if we can see, but it's shiny, it's white, that's blue cartilage. That's normal. All right. And as we get through the progression, here is a mild arthritis. So as you're bending it, you can see arthritic changes. Some of that blue shiny cartilage now has some dings in it and the cartilage is lost. So this is
Yeah.
mild. And then when you get to severe arthritis, you can
Ooh.
see that it's pretty bad. All right. Now, the best way to describe this in layman's terms is if you think of tread on your tires. God gives you the tires and you have a certain amount of tread on it. Some people have strong musculature where the tires don't feel as much support. So when you're walking, those muscles protect the bones from rubbing on each other. And so they don't develop the arthritis as soon as others do. But when you develop the arthritis, that tread from the tires is gone. Unfortunately, in medicine, we're not smart enough yet to figure out how to regrow this cartilage, how to make
Hmm.
this come back.
Yeah.
There's certain studies trying stem cell injections and whatnot. I would just say be wary of that. It hasn't been proven yet. All right. But it's
Hmm.
in theory, that we're trying to regrow that cartilage, make this come back to normal. Unfortunately, we haven't figured it out yet. And so once the tread on the tires or the arthritis has set in, the next best thing is a knee replacement surgery. And people are always confused about knee replacement surgery because they're concerned, like, what does it entail? It's
Hmm.
not like you cut everything off. It's more, if you think of it, as a resurfacing. So what we essentially do is we just remove the arthritic part of the bone. We don't cut all of it off. We just, if you
Right.
look, it's just shaving down the sides, and then there's a metal cap that goes onto it. And then the same thing on your shin bone side. We just shave just enough down of the arthritis to make it a flat surface, and then insert a metal with a piece of plastic that in the middle, and now you're functioning. Now these parts don't have nerve endings, so you don't feel pain. When you're walking, I tell patients you're going to have surgical pain after the surgery, but the minute you take your first few steps, that bone on bone grinding pain will be gone. So you're trading pains for a surgical pain, which usually goes away after a couple weeks.
Yeah, that's great. Thank you so much for that demonstration. That's really cool that you share that. Um, would like uh does working out and building leg strength help prevent the wear and tear of your
A-
knee?
Absolutely. So I'm sorry, I'm a car guy, so I'll use the car analogy. All right.
Yeah.
So if you have bald tires, all right, so your tires are bad, but you have excellent shock absorbers.
Hmm.
All right. Every time you hit a bump in the road, the shocks will absorb the weight of a pothole, and your tire doesn't really hit it as much. All right. The shocks in this example are your muscles, the quadriceps around your knee. Okay. If those muscles are strong, every time you walk, it's less force that'll go
Hmm.
through the knee
Hmm.
itself. So if you
Yeah.
have a bald tire but strong muscles, you can avoid the surgery. Again, which is why I have my patients that have some arthritis really try physical therapy for a little bit. If they try physical therapy and they get that strength in their quadriceps and their hamstrings, and now when they're walking, the bone isn't feeling as much of the stress. Your muscles are stopping that from happening. Now you're walking without pain, without surgery.
That's great. And this is a practice that you had mentioned that shouldn't just apply to orthopedics, but any field within healthcare. Look at the preventative options before
Absolutely.
going to the last resort.
Absolutely.
Dr. Shakir, this has been a really awesome conversation. Thank you so much for sharing your expertise with us. Um, any final words, or even before we get to that, like how can folks get in touch with you, especially if they're in the market for a new orthopedic doctor?
Yeah. So first off, thanks for having me, man. I love educating folks on orthopedic surgery, knee and hip stuff, and it's just something that again, the more you know, the more educated you are about the topic, the more you can help take care of yourself and get better. So for me, I've just joined a private practice in Scottsdale, Arizona. The easiest way to get a hold of me is through our website, shakirhipandknee.com. And through that site, there's ways to make appointments to see me in clinic. I am also on Instagram at Shakir Hip and Knee. I like to keep it very simple. If you message me on either of these two platforms, I can get you into our clinic and happy to see you and discuss the best way to take care of you.
Thank you. And before we sign out, we actually have a question from Randy. I'll put it up on the screen if you don't mind to
Sure.
take a look at that.
Okay.
So, could
I think
meniscus surgery cause
yeah.
damage?
Yes, it can, um, but that's hard to tell. So that's an excellent question, and because I got my model with me here, your meniscus are these C-shaped structures that are right here, and they act as shock absorbers essentially when you're bending your knee. And as you're bending your knee, if there's a tear in this meniscus, it will catch it every time it moves. And so when you have a meniscus surgery, whether it's a repair or a debridement, those are two different things. A repair is trying to suture it back together to keep it in place. A debridement is what I usually recommend, is to just shave it down and smooth it over so that when you bend your knee, it's not going to catch on it. Now, to answer your question, Randy, could it cause damage that results in the knee replacement? Yes and no. Yes, it can, if depending on where the tear is located and if it's causing a lot of catching and locking symptoms. However, you got to, again, preventative wise, what caused the meniscus tear in the first place? So that meniscus tear, whatever the injury was, that cartilage has already been damaged a little bit. So what came first, the chicken or the egg? Was it the meniscus tear, the injury that caused the tear, that resulted in a knee replacement, or was debriding the meniscus too soon causing the knee replacement? I don't know. Impossible to tell, but it's a great question.
Dr. Shakir, thank you. And Randy, thank you for dropping your question. Feel free to connect with Dr. Shakir here on LinkedIn. And yeah, final words before we sign off.
No, thank you so much for having me. And, I really love educating about orthopedic surgery. I'm very passionate about it. Please reach out if you have any questions about anything. If I don't know the answer, I'll find out the answer and get back to you.
We really appreciate it. Have a great day, everybody.
Thanks.